Today's guest on the podcast is Dr. Shalini Sharma. Dr. Sharma is a counselling psychologist and therapist with over 2 decades of experience. Specializing in emotional intelligence and behaviour therapy, she has worked with big corporations. She founded P.A.U.S.E, Walk, Run, where she and her team take counselling and therapy sessions for individuals and organizations. She's an author of children's books, conducts workshops for parents, educators, and children across India, and is currently a visiting counsellor at Plaksha University. In our conversation, we explore the mental models used by a therapist, degeneration of emotions, extrapolate observations from therapy to societal issues, deconstruct conversation, and browse the therapy landscape in India. Let's go into the conversation. Thank you for being here and welcome to the podcast. We'll jump right in.
Sure.
So, in traditional healthcare, there are visible cues, there is measurability, and basically lesser room for subjectivity. So there's like a root cause analysis, eliminating possibilities, and then addressing those issues. But when it comes to something like mental health issues, what is the model of operation? What kind of mental models do you employ as a therapist?
So that in the case of mental health, like you said, of course, things are not so tangible.
Right.
And so we also look at mental health. It's not like a binary state, first of all.
Mm-hmm.
It's like on a continuum.
Mm-hmm.
So it's not that you're either mentally healthy or you are mentally ill.
Right.
So it's like on that spectrum, you are somewhere or the other on that spectrum there.
Yeah.
And so we, in terms of when we are looking at mental health, so on one side I can say there is well-being.
Mm-hmm.
On the other side, in between, there is stress, anxiety, overwhelm.
Mm-hmm.
And then on the other end of the spectrum, there could be something like a clinical diagnosis.
Mm-hmm.
Right? So that's the way I see it, and that's the way we also look at it. Like, so during any period of our lives, we could be anywhere there, right?
Right.
So we could be, sometimes things could not be going well, sometimes things could be going well there.
Yeah.
So in terms of literally a clinical diagnosis, when it comes to, we have this manual, which is called a DSM.
Yeah.
Okay, and that has listed out a criteria of what comes under and what are we to look for under each of the mental health disorders.
Conditions. Okay.
Yeah. So, and as an individual, I should be falling in, say, for example, I'm just saying,
Okay.
should be falling in certain number
Got it.
of
And
criteria.
so when
there.
it's not at that clinical stage yet,
Yeah.
then there is a whole kind of like murky spectrum.
Yes.
How do you navigate in that space? Like, I'm particularly curious about when a situation comes across you. Now, I mean, I could have a conversation with somebody too, but as an expert, what sort of mental models do you employ to like develop, first of all, a robust understanding of the situation and then look at helping out the individual?
So see, in any session, first of all, the way we go about in therapy is to first figure out why the person is there. Like, what is it that they're looking for?
Mm-hmm.
Is it just something like a specific instance which has caused any kind of anxiety or an overwhelm kind of a feeling there?
Right.
Or is it something which is there is a root cause of it, depending on, it's like a pattern, it's a habit which
Right.
is being formed.
Right.
So sometimes a lot of people who would come would look for very quick fix kind of solutions, like just
Yeah.
tell me what has to be done, just
Yeah.
tell me what has
Yeah.
to be done.
Yeah.
And some of us would be willing to sort of figure out and go back and see the relationship between certain experiences which we've had
Okay.
in the past,
Okay.
and then figure out where I am today.
Okay.
And then how do I what are new things I can do? What are some of the different things I can come up with? How can I change my patterns
Right.
there? So it all depends, first of all, just establishing that connection.
Yeah.
First figuring out, I feel, also it's not like you have to do this and you have to do that. And it's more like, what is it that you're looking out of that session there? Why are you here today? Kind of a question which needs to be answered. And then also just being open to the possibility that sometimes I might want to say so many things. So many things.
You mean you as a therapist?
As a therapist, I might want to tell them so many things there, but also looking at and gauging, is this other person at that point where they're able to receive what I want to say?
Right.
So I think gauging that is also extremely important there.
Right.
So that's the way normally we look at, apart from a clinical diagnosis.
Right.
And somewhere I also feel that each one of us at some point of our lives, if we go through the DSM, the manual there, we all will fall into it at some point of our lives there.
Right.
So it's not there. So the difference really comes in how frequently we go into that space and how that feeling of that I'm stuck here. Those are the two things which we want to see. That are you really stuck here?
Right.
You can't move forward, or is it just something that, because each one of us will go through that,
Sure.
like anxiety, overwhelm, not knowing what to do, not wanting to get out of bed.
Right.
But is it that I don't want to get out of bed at all and I'm not able to function?
Right.
Or is it just like an on and like it's
Right.
just happening because of certain situations and certain experiences here?
Interesting. Right, so there's like building the connection.
Yeah.
And then kind of like exploring the landscape with the individual.
Yes.
And you have to also tune your style of exploration with respect to how the individual is responding in that setting.
Yeah.
Interesting. So you spoke about like, I think you touched on anxiety and depression and some of these things. I think there's a lot of literature around it, but it'll probably be interesting to speak about like, how is the experience of these things in the body? Like there are so many terms like this: trauma, anxiety, depression, heartbreak, and even like closure, if you look at it sort of in a cycle way. How do we experience, like what is the experience of these things in the body, and like how do they sort of differ from each other?
I'm really glad you brought that up because somehow we always look at it, all these things which you just mentioned, as something which is just happening to us. Like it's something which is not, we don't really connect to the internal part too often in terms of actually recognizing what is happening in the body. Because even in traditional therapy, when we talk about talk therapy and things like that, I think it feels good for some time because you're able to come and talk, you're able to share your experience with somebody, but at the same time you're not really understanding or recognizing what is happening inside your body there, right?
Right.
So in terms of, say, anxiety, so basically anxiety is again like a way of our body to protect ourselves, right? Because anxiety is something which is connected. So there are two very important components of anxiety. Say there is uncertainty, because it's always connected to uncertainty, something in the future.
Right.
And there's also this feeling that I'm underestimating my ability to cope with that uncertainty.
Right.
Right. So those are the two very, very important factors of anxiety. And so the way it feels to us is, and anxiety might feel differently to different people.
Yeah.
But most of those things are like your heartbeat, an increase in your heartbeat, your breathing becoming really rapid, your maybe sometimes shaking, trembling there. And so say when we start recognizing what is happening inside our body, it's really interesting to see that we then start looking at it. This is basically how my body is responding to a threat outside. So it doesn't become like a me. There's something wrong with me there. So if we are able to differentiate between that, I'll give you a very simple example. There was this, so we were talking about this, of how we could talk about anxiety with anybody, say with kids at one point of time. And we were looking at this like in the animal kingdom, I might be digressing, but just to, so in the animal kingdom, if you look at it, anytime an animal is sort of hurt, not fatally, but they start shaking and trembling, right? So that is a way where your fear, the energy, it sort of gets dissipated. It's a way of taking it out That's why the trembling and shaking happens. And if you'll see, even in us as human beings, sometimes the shaking starts happening when we are anxious.
Yeah.
Right? So there was this parent where we had shared this with, and this kid was really, really very anxious to go on a roller coaster.
I see.
And was like, started shaking and trembling. And so this parent, who was slightly more aware of what is happening, a very natural, normal response would be, why are you scared? It'll be okay. It's absolutely fine there. But this parent was like, I can see that you are trembling.
Right.
And so this might be that you are scared of something. And this is how our body reacts to when we are anxious or we are scared of something. So maybe a good idea is to would you like to just run around a little bit and move around a little bit so that we can dissipate that energy from ourselves there.
Right.
So just that understanding.
Recognition is a big part
such
here.
a big thing. Such a big thing of that there. And also, like if you'll see, there's a lot of research which has been done on that, of what areas of our body are like, what areas of our body are there, like sort of, which are activated, which are not so activated when we are in certain emotional states. So like for example, sadness, shame, guilt,
Right.
you'll have very different areas of your body which are activated
Right.
and deactivated.
Right.
So just recognizing what is happening inside our bodies is like literally like the first step
Yeah.
of maybe when we are dealing with anxiety, with depression. And this is something which we are not used to actually.
Right.
Like right from childhood, nobody really tells us,
Yeah.
like, start recognizing what is happening inside
Yeah,
your
it's
body.
always
What is
kinda
your
like,
body telling
like,
you?
Yeah, like just do away with it. Like it'll go. Yeah.
It'll just go away. It's a phase.
Yeah.
We all go through it.
Yeah.
Don't worry.
So, and like, once this is recognized, then what is the next step?
See, I still feel, okay, I have this thing of the word pause. I use the word pause a lot.
Yeah.
Okay? But pause also stands in this connection. So each of these letters stand for a certain step.
I see.
Okay.
Okay.
So say, for example, P stands for pause, which would be, in case we are going through any kind of an emotion, stop, drop and breathe. Like literally pause. Stop
Okay.
anything you're doing, drop it. Drop everything you're doing right now and just
Right.
breathe.
Right.
And breathing is also not that it'll shift us out of our feelings and emotions. Breathing is just to let us know, like, my feet are on the ground, I'm here.
Okay. Just to like re-establish the connection with the body.
Yeah, body, that I'm here.
Yeah.
I'm breathing, I'm safe, I'm present,
Yeah.
I'm here.
Yeah.
That's what
I think with like tuning into your breathing is also a way
Yes.
to like come into the like moment, like
Absolutely.
reality.
Absolutely that.
Yeah.
A stands for acknowledgement.
Right.
Acknowledgement of basically, so here this is what is like, what am I feeling, what is happening inside my body, if I'm anxious, is my heart beating fast, is my breathing rapid, is there something weighing somewhere, am I feeling some kind of tightness somewhere there. So that's all recognizing what's happening inside of you, right?
Right.
And also figuring out, what would I be feeling? Am I angry right now? Am I disappointed right now?
Yeah.
Am I overwhelmed right now?
Yeah.
So just that kind of a thing there,
Yeah.
right? U, P.A.U.
Yeah.
U comes to understanding what is the need behind that emotion. If I'm angry, what was that need which was not fulfilled? What was it that I wanted and needed, but it never came to me,
Right.
right? So going a step down there, like literally trying to uncover what was underneath that emotion there.
Right.
S would be sitting with that feeling
Yeah.
and not trying to shift out of it
Yeah.
there. Literally sitting with it and feeling that discomfort
Yeah.
there, which is the hardest.
Right.
And then E would be expressing. But E, again, expressing would not be that I go and always talk to somebody about it. It could be also something I could journal. I could do something on my own. It's not necessary that I need another person
Yeah.
for expressing
Yeah.
that
Yeah.
part.
Yeah. Yeah.
So P.A.U.S.E.
Yeah.
So
That's a
where
cool framework. I think that also like is probably ties into like the first question I asked. Like that's also like a mental model when like when you're in a situation.
Yeah.
I think I had so many interesting questions pop up in my mind while you were talking. One of them is so when you are in these situations of interacting with another person in therapy, how do you balance between the need to sort of support them and kind of like, you know, I don't want to use the word empathize because it's kind of like, yeah, we'll have to define it, but like between supporting them and also like pushing or challenging their like suboptimal mental models, like how do you navigate that space?
So what you're trying to say is that we want to support them at
Yeah, one
end,
is to like
but
comfort them and you know, like a lot of times like the perception of comfort is just like accepting whatever the other person is like, however they are being, but you also want to like nudge them or challenge them to look at things differently.
Yeah. So I think, so that what happens there is that I think this goes, the way we normally do it is by slightly framing the right kind of questions. And because one wants to actually, so there's so much one can say, like I was telling you before, but it's not going to land the right way. So it's something where we would literally frame a question which could take them to a certain part of their life, or maybe think about that and see how is it connected to how we are behaving today or at present there. Because there is so much of actually, so much is connected and tied with all our growing up experiences, right? So I normally during a therapy session, or normally during a session which might not happen in the first session, or it might not even happen in the second session there. So trying to see, is this person okay to sort of talk about something?
Are they ready to examine?
Yes.
Yeah.
Are they ready to examine? But I think the right questioning and the right kind of questioning makes a lot of difference there.
Yeah.
That does.
I think another interesting thing you touched on was, so you would like inquire people to, even like in P.A.U.S.E, you spoke about like, what is it that I'm feeling? What is the emotion? Why is it difficult for us to describe our feelings and emotions? Why do I not have an immediate answer?
Because I think
what's going on inside
because
me?
I think we've never been educated on emotions. It's never been a part of our growing up years. And it's been literally carried on like that. I mean, whenever I think emotions have also got a very bad reputation to themselves. Like they come in the way of decision making, they come in the way of learning, they interfere with things. So we normally want to stay away from them. We want to avoid our emotions. So like normally when we talk about that, like anger, whenever we think of anger, normally people don't look at it in a very in good light,
even in a neutral light.
Yeah, we don't. So anger is always the first. If I say anger, the first thing which normally comes to mind is somebody really furious and shouting and screaming and making a big scene, right? That's what normally we think about anger. There's always destruction involved there. But anger can also be seen. So anger, when we talk about, say, an emotion like anger, it's basically when my boundaries are violated or crossed and I'm not getting what I wanted, right? And so when we are also talking about anger, we can look at it as, say, it could be the something like a situation where there's a road rage, right? That's anger. But there's also anger which is like more like a justice-seeking anger. I will put my foot down. I will speak for something when there's injustice happening. That's also anger. Right?
Yeah.
But just understanding that each of these emotions actually has a message for each one of us.
Yeah. So like the emotion in the body is like only like the surface of the situation.
Yeah.
There is more to like go and examine.
Yes.
But like the way sort of like our society functions, I think like those things have not been like part enough of just like engaging with these ideas and you know, because like I was thinking, if we look at like kids and like children, they are in touch with their emotions and feelings, but as people grow older, increasingly they grow like more distant. So something's going on in that like process of growing up. And there are also like examples when this is done well, because obviously there are like people and parents who've done this well, and that is kind of like apparent in the bringing up of the child, right? Yeah.
And I was just asking you, like when you were asking me, so why aren't we able to why is there so much of hesitation in terms of emotions, right? Like, and mostly when you even ask, even our emotions vocabulary is not a very huge one.
Right.
It's like everything is clubbed together. We are not able to even differentiate between various, the intensity
like
of emotions.
I don't have the word in my mind, like, because I don't know what is this thing called. Yeah, and then it's even more frustration because like I don't know how to like talk about this. Is there a difference between feelings and emotions?
There is basically, but normally in our everyday language, we use them, we just interchangeably use them, emotions and feelings there. But emotions are basically, there are actually changes going on inside our body. They are like, we have core emotions, like basically anger, fear, love, disgust, right? And feelings comes more in terms of when we, there's a story added to it. Literally, like there's a story of our own added to it there. Right? And so then there's another thing which is mood. So we have a slight distinction, a very scientific distinction between emotions, feelings, moods. But normally when we are talking every day,
for a layman,
it's like emotions, feelings, we interchangeably use them there most of the times.
Cool. Let's talk about something interesting. If we sort of walk back from the issues that you come across in therapy, what important things does it reveal about society?
Okay, interesting.
What are some of the common issues you come across, and what does it tell us about society?
Okay, I think overall, I always feel, because I lean more towards growing up years of any individual there, right? That it's like the base. It's the
Those
foundation.
are more formative, would you say?
Yeah, absolutely, absolutely more formative there. And most of our patterns, our habits, the way we behave, the way we think, the way we feel, that template of ours gets formed during those years, right? And so that's that kind of template which we follow in our adult years also. And so most of the things which we struggle with as adults are normally adaptations which we made in childhood. Are actually adaptations, but all adaptations which we made as a part of existing, as a part of surviving. Right. So I always feel that somewhere that part is really important, and we do need to at least pay some importance to the way we are interacting with our kids. And actually I lay a lot of emphasis on that. There. But at the same time, yes, we ourselves, but I also feel that every parent damages their kids to a certain extent, right? And each one of us. So maybe, and it's also there's a lot of research which points to the fact that the well-being of any child is actually directly proportional to the level of self-awareness of the adults involved in the child's life.
Interesting.
Directly, absolutely directly proportional to that. So it all comes to sort of trying and increasing our own self-awareness, figuring out what's happening at my end. It's a very easy way of putting it across to others or taking it out on others, but ultimately it does come to that.
So are we able to map these, like the issues that you come across, and walk them back to what are the issues that like, so we've kind of established that a lot of this is happening in that growing up process and that interaction between the caretaker or the parent and the child. But what are some of these like common issues that are happening which are causing problems later on?
So are you saying the kind of challenges which we are facing at present?
Yeah, I mean like in the child and parent relationship, what are the things that are
Okay.
going off, like patterns in terms of like a lot of this is going wrong, like in many cases this is going wrong?
See, one would be my own awareness about myself.
Right.
Right. I'm carrying my own baggage.
Right.
I'm carrying my own challenges and stuff happening there. So I'm not able to deal with that.
Right.
That would be one. Then the same thing which we are talking about, we've never been educated on emotions and feelings. We've always been told to be away from this. This is something which we don't want to be involved in. And very common statements like, don't cry, don't feel angry,
Right.
don't cry like a small kid,
Yeah.
don't cry like a girl.
Yeah.
Right, all those things, right? Then also the fact of a very simple thing like we were talking about recognition of emotions and feelings inside our body, like what is my body telling me, right? A very simple thing like which we've all encountered, I think, is when we are having dinner or meal times, right? And if a child is not having dinner or is not finishing their lunch or dinner there, normally it's like, finish your food, finish your food. No, I'm full, finish it, right?
Yeah.
We are not understanding that maybe we are not even encouraging the fact of like, trust what your body is telling you.
Right.
We are totally
Right.
we
And
don't even
these things are compounding.
These are all compounding.
Right.
Right. Also, things like I also, whenever there's a disagreement between a parent and a child or any adult and a child there,
Yeah.
it's always like we are more focused on that I have to be right and the other person is saying no there. So it's more like that disagreement. It's not, we never view it at maybe this child, this is like a practice ground for my child to figure out what happens when I say no.
Yeah. Yeah.
Right? So it's like we are literally taking everything as like, no, I'm the one who knows everything here.
Yeah.
And I cannot receive information from this side. It only has to be from me to this individual here.
Yeah.
And I think that also, and I'm not saying that parents are not doing a good job or anything like
Yeah.
that, but I think there is so much happening.
So many like blind spots.
Absolutely.
And like while you were talking, I think there's like so much scope for just like for self-awareness in terms of like on the part of parents, right? And I think a bunch of your work also kind of revolves around that.
Yeah,
You work with
yeah.
parents, educators, and
Yeah.
children.
So I also feel, just to add a little bit to that, so that like say anything which may happen, it's very easy for me to put it out there.
Right.
So maybe a different way of doing it would be also understanding what is happening inside of me that time.
Right.
So that's where I think that self-awareness comes. Like if I'm screaming at my kid,
Yeah.
it's very easy for me to do that
Yeah.
and take it out
Yeah.
and blame and whatever.
Right.
But there's also something happening inside
Yeah.
there.
Yeah. Generally, I think like being that person who's like always sort of examining situations, that takes a lot of hard work.
Yes, and we all want to avoid that. And it's so easy to put
It's
the blame on
convenient-
somebody else.
Sometimes it's convenient to avoid it,
Yes,
I guess.
yes.
What are therapist red flags? How do you differentiate a great therapist from a mediocre therapist?
I always feel, one is always, we always say, please make sure that that a therapist is competent to sort of, in
Yeah,
terms of competency.
I don't know what that
there.
means.
In terms of like, do you have, are you educationally qualified
Okay,
to,
like trained enough.
trained enough
Okay.
to take therapy.
Okay.
But for me, more than that is somewhere where you can actually feel comfortable, right? Because then there's a relationship between, say, those two people
Right.
there, right?
Right.
And also the fact in therapy, from time to time, a therapist where you are able to say, okay, this is something which I'm not liking in the therapy sessions, or I like, you can voice your disagreement, you can bring
Right.
about a change in plan there.
Right.
So where I'm comfortable doing those things
Right.
is something, again, I would
It's
always
like a sign of
always-
health, basically.
Absolutely.
If it's like a one-way situation, just like advice coming my way, that's not
at all.
cool. You need some tension between like back and forth.
Yes.
And
yes.
like,
yes.
Yeah.
Yeah.
Interesting.
So that's something which is very extremely important, I feel there.
Yeah.
And yeah, I think basically.
Cool. What are so within like mental health, what are the subcategories And like, how regulated is this space in India?
Not very, actually. Quite a...
Yeah, because like that's quite a concern, because like I know of situations where someone's done like a diploma and then like they're calling themselves like mental health people. So yeah, just want to get your thoughts around that.
I think we do need a lot of more regulation to come into this area, and things are happening.
Right.
Like there is some movement happening in that space there. But at the same time, at present, not too many regulations there. So that's why all the more important to literally, and when you're talking about the red flags, also figure out and ask the person about like, are you trained to do this? Have you done this before? And things like that.
Yeah.
And then that's where I meant like, are you educationally qualified to sort of take a therapy session there? Because so many of us actually look at it like therapy, oh, that's just talking.
Yeah.
I can just sit
there.
Yeah,
like I feel like I can talk, man.
I can just listen. That's all I have to do there, right?
Yeah.
Not much.
And so within mental health, what are the subcategories? Because I know there's like a spectrum. So what are those, and like how do I know where do I have to go?
So see,
as like a layman.
So see, we first of all, we have a difference between a psychiatrist and a psychologist, right? So a psychiatrist would have an MD, like has gone to a medical college.
Okay.
And a psychiatrist, so no psychologist can recommend medication.
Right.
Only a psychiatrist can recommend medication there, right? And then within psychologists also, you'll have different various fields of psychology. So you have counselling psychology, you have clinical psychology. But right now also between clinical and counselling, there's a lot of overlap.
Right.
Like in the sense, most of us are able to be able to figure out what is happening at this person's end.
Right.
But for a clinical diagnosis, then maybe you'll have to go to a clinical psychologist there, right?
Right.
And
so the counselling psychologist can't diagnose.
There are a lot of counselling psychologists who do diagnose also there, but otherwise clinical psychologists are the ones who I would always recommend go for a diagnosis to a clinical psychologist there.
Sure.
And then therapy can happen side by side, like parallelly with, say, in case a diagnosis is done and then medication is required. So medication and therapy can happen parallelly.
Okay. So clinical psychology, is that more like the nature of
testing.
That stream? Is that more sort of eliminating and like mechanical in some, by mechanical I mean like what is the model of operation of?
So see, in clinical psychology again, so following the DSM like I was telling you about.
Okay. So
following that and looking
some,
at like where does it fit into? Is this person falling under this category?
Okay.
Is he or she meeting that criteria there?
Yeah.
So that clinical diagnosis, giving the required tests there based on that. So a lot of testing involved there also.
I see.
And therapy is also done.
Okay.
Yes.
Okay. So between a therapist and a counselor, how much is like, is there a line between
here
those?
I think in India it's literally taken as the same thing there.
Okay.
Literally taken as the same thing. But again, as a therapist, also I will have my own way of an inclination towards certain therapies. Right. So there are so many therapies.
Different modalities.
There. Yes, different modalities there. Right. So depending on that's why I said see your comfort level. Maybe ask how do you deal. Right. Like what are some of the therapies you are trained in?
Yeah.
And see if you are comfortable with that there.
Right.
So having that basic kind of a knowledge there of what can I ask a therapist when I go in for a session there would be a good thing.
I think that makes sense. Yeah. Within when you say different modalities within therapy, those be like what, like art therapy or
they could be art therapy, they could be actually, so there is some part of it which we call there are so many therapies there. We have cognitive behavioral therapy, that's CBT. We have REBT, which is again, I mean that's called rational emotive behavior therapy.
Yeah.
There is transactional analysis. There's something called internal family systems.
Okay.
So there are lots and lots. So there's acceptance therapy.
I see.
There is something called DBT there.
Okay.
So all following a different way of trying to understand, but then each one of us will also respond very differently to different therapies.
Right. Like so there's some bit of like exploration involved here for also like an individual who wants to go into therapy to find out like what modality is the best, like most suited for them.
Exactly.
Like things like
And also
those.
that's where that conversation between the person and the therapist comes in, right?
Right.
And then you see, are you comfortable going through that?
Yeah,
there?
sure.
And there's like what you were talking about the body. So there's something which we also like, which we had mentioned in traditional talk therapy was basically just talking. But we are also involving a lot of this thing called somatic therapy, which
Right.
involves the body,
Body.
the sensations. So I think that's an integral part of therapy.
Right.
Because just talking about the brain and your thoughts and everything, it's all connected, right?
Yeah.
So bringing that aspect is extremely important, I feel.
Fascinating.
Yeah.
I recently started the podcast, and I think we also had the chance to speak about it. Like, I had a lot of like imposter moments. What are your thoughts around navigating imposterity?
See, I think the way I look at that imposter syndrome is that I think most of us go through it, first of all. And the fact that we are getting that feeling just makes us feel that maybe what I am about to do or I am doing is something which means a lot to me. It is important for me in a way. And that's why that I start feeling that maybe I might not be able to do justice to it. Or maybe there's a gap
Yeah.
between where I am and where I want to be.
Yeah.
Right? But I look at it saying that maybe in terms of doing most of the things, if we are experiencing that part of us, that also shows the fact that maybe what I'm doing is important for me. And I'm already in that space where I would like to give in or maybe put in that kind of work to
Yeah.
do a good job.
Yeah. So where do we draw the line between a healthy amount of like this skepticism about like my ability, and at what point does it get like unhealthy?
I think that part where it's coming in the way of me even delivering and doing things, and like I said, all these things, all
Right.
the things which we struggle with today, Siddharth, will always be adaptations which we made in our childhood somewhere.
Right.
So till a certain point of time, they will work, right?
Yeah.
Because it was happening. Things were happening for me.
Right.
I was moving.
I became operational.
Yeah.
Yeah.
But now if I'm seeing that it's really coming in the way of it,
Yeah.
means that I will have to figure out, am I taking it like too much to an extreme, and why am I doing that?
Yeah.
And why is it coming in the way there? And this worked for some time,
Right.
but now maybe during my present circumstances or situation, what is
Yeah.
happening there for me?
Yeah.
And why is it so important for me to maybe be a certain way in the present situation there?
Interesting. And so then, in such a situation, your work would entail navigate going to like working backwards to what were those moments, and then unpacking them,
Yeah.
processing what was left over
Yeah.
to be processed back then.
Yeah. And also, I think in this case, always also figuring out that what was required, why did I require to adapt in a certain way
Yeah.
at that point of time?
Yeah.
And it's maybe helped me. In what way did it help me?
Right. So that's also like the part of recognizing
Yeah.
of the situation.
Yeah.
Cool. So as a therapist, getting people to share authentically is like a core skill. And I believe like there's a certain dynamic to it in therapy, because there's already like high intent on the end of the individual who's coming in, because they basically want to address their situation. But like outside of a therapy situation, how to approach conversation to like help disarm people and like connect deeply.
Say that again. Like outside a therapy session?
Yeah, in like a non-therapy situation, how to get people to open up and disarm them in a conversation.
For any person,
Yeah.
you're saying?
Yeah.
Okay. See, I sometimes also feel that maybe in any conversation which is happening, we are always in the beginning, they're always, we are projecting something, right?
Right.
We're always projecting something there. So now it depends in terms of the conversation there. I mean, I could use a few words here and there and tell you like
Yeah.
your authentic self and sort of to put down your guard and then have a conversation there. But we are all gauging each other. We are all trying to figure out where is that sense of safety when I start feeling safe in a conversation there.
Right.
And I think more than the words, it's our tone, it's the way we are talking there, which
Right.
makes the other person feel safe
Right.
to sort of feel more comfortable.
Right.
And also our intention
Right.
plays such a big important part. Like what am I trying to achieve through disarming the other person?
Yeah.
Why am I doing that there?
Yeah.
I think taking care of that part, and it's not easy. It's really not easy to have that or achieve that right in the beginning.
Right.
So going with the fact that yes, I would like to sort of maybe provide that space where the person is able to sort of speak what they want to speak without me getting really defensive about it,
Yeah.
without me reacting so much to what they may be saying, and also being slightly curious about it.
And yeah, like that's interesting. And like in those situations, I might want to disagree with some of the things. So how am I able to like authentically sort of disagree, but also make them feel that like I'm listening to you?
Yeah. So see, that a very important distinction comes there between like we don't want to reach a point where we are shaming the person while we are doing it.
Right. I guess that's just like a blocker.
Yeah.
Then we're not talking anymore.
Then we are not talking. Then it's just like we've taken something very personally, and it's something which else is coming out in a conversation. Then. Yeah. So I think, and also I think approaching it with some kind of curiosity, like say the person is saying something and I do disagree with that.
Yeah.
I just want to be curious, like why is the person saying what he or she is saying?
Sure.
Rather than like, why are you saying it and it's not supposed to be said and stuff like that.
Interesting.
Yeah.
What do you feel is like the impact of working with people in therapy? What is the impact on your own personal well-being?
Okay. Yeah. See, it does. I think it impacted me a lot right in the beginning of my practice.
Yeah.
Because I would be so involved in what the other
like you're
person was
receiving a whole bunch of just unprocessed information.
Yeah. And a lot of it during the whole course of the day.
Right.
And so I think in the beginning it did, even though like as part of our training we are taught like to sort of put some kind of like a boundary between ourselves and the client there.
Yeah.
And but to be very, very truthful out there, I struggled with it for a long time.
So when you speak of this boundary, what kind of boundary?
Boundary in the sense that we are not responsible for making a person feel a certain way in terms of, so it's not like if there'll be things which will not happen the way we want a therapy session to go, right? So also feeling that everything has to be perfect.
Yeah.
Like the person should walk out of the room with all answers.
Yeah.
There.
Yeah. And like, how do you feel that has changed for you over the period of time?
So over a period of time, I think it's just that I think I've become better at processing that information after every session, right? Also understanding that I also am a human being and I will not have all the answers.
Right.
I am not supposed to be providing all the answers.
Yeah.
And also that it's more like my role is more in terms of making the other person feel that they are in that place where they can find those answers themselves. So it's taken me some time to do that. And also the fact that there've also been times where I've been so much into a particular like a client's process and the journey there that it's at the back of my mind throughout. Like, what are some of the things which we can do? How can this be done? I wish this person had not done this, and I wish that person had not done that.
Right.
And so it's literally every time I have to be really, really consciously tell myself, I am not really helping the person by doing that.
Right. Yeah.
So I would be literally lying if I say, oh wow, I can process everything so well, and I am totally cut off from what is happening after the person goes. No.
Right.
It does not happen that way.
Yeah. And so, like, what are some of the things you do to regulate?
I, first of all, I always do my own writing after every session.
Okay.
That helps me process.
Right.
I do not like doing it on the laptop. I like to write.
Okay.
So I have my own way of doing that after every session. That's something which helps me tremendously in sort of...
What is the difference between writing on a laptop and writing on a paper?
So see, again, scientific research also shows that writing on paper, just the weight of the pen on the paper sort of helps in, it feels better there. And I would always recommend even in my sessions to hold a pen and a paper there.
I just wanted to ask you that because honestly, like, I agree with that. But
it's just a different feeling that your words are literally being created right in front of you.
Yeah.
Kind of a feeling there.
Yeah.
So that helps a lot.
True.
And also having a therapist of my own.
Yeah, okay.
That's something which helps a lot.
Cool.
Yeah.
Given that, you have a elaborate experience of working with people over 20 plus years now, what are some of the nuances you've learned about human nature from your work? Given that, like, people must have confided in you deeply, and like it's almost like in like a therapy conversation, the kind of like some of the, you probably have had like a lot of like deep conversations that, so what are some of the nuances you've learned from there?
See, first of all, during my therapy session, Siddharth, I've always felt that I think it's really difficult to open up to somebody when a person comes into a therapy session, right? So it's
for them to open up to you.
Yeah, for them. I always put myself in their place somehow, that it'll be really, really difficult for me to come and start opening up with the deepest memories of my life with a stranger.
Yeah.
Right. And so I truly feel that it's literally a privilege to sort of sometimes even hear, like have people come in and talk about that. And so over the course of years, I think each one of us, and I include myself in that, each one of us has that innate core need of feeling seen, that I'm seen by somebody, I'm heard by somebody, I'm listened to, and I'm understood. And each one of us are trying to find that in our own ways. Absolutely each one of us. And sometimes we just get so focused on one of these things that it becomes difficult to see myself outside that.
Right.
There.
Right.
And if you look at it, this is the underlying core need of each one of us. I want to be seen, I want to be heard, I want to be understood.
Yeah. And that again sounds like a great, I don't like the word like framework here, but that's a great like way to sort of establish a connection with another person by sort of enabling, like, you know, these things in that exchange, right? Yeah.
And I also feel, I think also, and I'm not talking about that we don't need to support people, but I also feel that as human beings, we also do tend to complicate things a lot.
Yeah.
We do tend to complicate things a lot there.
Yeah.
We like complications.
Would you like to unpack that a little bit more? What exactly are you, because like it's an interesting idea. Like this is something like people say a lot, like I've heard a lot, but what the hell does it mean?
Like it actually means like somewhere that, like when I talk about these things, I want to be seen, I want to be heard, I want to be understood.
Yeah.
Right? So those are the core basic needs.
Right.
Everything above that, there'll be layers and layers and layers and layers and layers of stuff.
Okay.
So to reach that part, I might have to really go deep down to figure that out.
Got it. Yeah. A lot of peeling involved.
Lot of it involved there. So it's like we like to have all those layers between what I really require
Yeah.
and what is happening right now.
Yeah.
So it's literally like I'm not okay if I can say I want this and I can bypass all that.
Right. Yeah. So as somebody who's like, you've had 20 plus years of experience, so as someone who's extremely experienced in the field, what would be your advice to someone who wants to pursue mental health as a career, and how do they find out if it's the right choice for them?
See, I would always encourage people who to enter this field, because it's somewhere that you also have to feel the fact that if you find just understanding human behavior fascinating, like there'll always be a different.
Yeah.
There'll be theories. There are books. But there's
Yeah.
always something so unpredictable and something which you really, really like in terms of conversations
Right.
and figuring that part out.
Right.
So if you have that need to be curious about things, of just asking like, why do you think this person might be behaving in a certain way?
Yeah.
If that curiosity is there, and if you really have the patience to listen.
Right. I think patience is a big one.
Yes. Patience to really listen and not wanting your own stuff to come into a therapy session. That's something which is so important.
Yeah.
Because it's sometimes like, oh, I know this, I have to bring it into the session, kind of a thing. That kind of a feeling sometimes. So all those things, I would surely, absolutely encourage people, because this is something which is not just as therapy,
Yeah.
but I think just the field of psychology, I know I'm biased towards it right
Yeah.
now, but it's one of the most fascinating
Right.
areas.
What would you say is at the heart of the training of like being a mental health professional?
I think understanding yourself. Actually understanding yourself. We think like during every therapy session, Siddharth, I always feel that it seems as if the therapist is helping the client, right?
Yeah.
It's the other way around also.
Right.
So I also feel, I think, actually understanding yourself. And
Yeah.
through this whole process, that's what happens.
Yeah.
Like if I look at myself, say 20 years back, there's so much which has happened and so much which I've learned about myself during this course.
Yeah.
There.
That's true. As a career, is it a lucrative career? I'm sure people are gonna have this question. What are the prospects?
See, out here, I know like a lot of people, I've been actually talking to a lot of people who've done their masters and are struggling with finding the right kind of fit. Like, and maybe if not having had good experiences during internship and stuff like that. But I guess that happens with not just in this area, psychology, but when you're venturing out and looking at a career anywhere. But I still do encourage them, and I would really I've actually been talking to some of them saying that don't give up on this.
Right.
It's like literally like be there. And so in India we are still, and I think after the pandemic there's been so much more awareness about how important it is.
Right.
So those opportunities are coming up. But as it is, I think as a parent somewhere also I hear like, how much is this really the right career for my child to be in?
Yeah.
Is there a future for this career here? We still have that stigma attached to it. How many people will come?
Yeah. Those are some valid concerns, I feel. Yeah. There's also like I feel so many like new careers to just invent within this space. This whole space of, for example, helping parents just be more aware of like what are the best practices to bring up a child. That's a fascinating space to get into. Right.
Because I also feel like here as parents in that area, I always feel that we can be those cycle breakers kind of a thing.
Yeah.
Right? Do something differently.
Right.
Something differently than what was my experience with.
Yeah. And that's also almost like breaking an archetype. Then others can see like examples, and then more and more people following.
Yeah. And then we have so many other fields which are coming up in psychology. So many of them, like forensic psychology is really coming up now.
Right.
organizational psychology, sports psychology is coming up in such a big
Yeah.
way
Yeah.
there. So now the need for a sports psychologist to be associated.
Yeah, I like the idea of that, how I feel like at the heart, like it's about being curious about like the human processes
Yeah,
and
yeah.
working from there.
Yeah.
What is the Apple equivalent of in therapy? Like, what keeps a therapist away? What should I do to keep a therapist away?
I'm just looking at why would you want to keep the therapist away?
Just because like I want to keep the doctor away, so I just kind of like took
Because
from that thought.
here what I'm thinking of is like, because normally we'll also look at therapy only as when I'm in a crisis, right?
Yeah,
Right? That's how I associate therapy
Right,
with.
right.
But here I'm trying to say that there is a shift which is happening, that therapy is not only for
right.
like navigating
Not
through
only
a crisis.
prescriptive,
Yeah.
but
It has
preventive.
Preventive.
Right.
Absolutely. Learning skills.
Yeah, just also like I think just like developing a language, like
Absolutely.
developing a language to communicate
Yeah.
within yourself.
Yeah.
Yeah. But I think that the sort of there's like a connotation with that is associated with like these.
I'm still trying to think of the Apple part which you're talking about.
Yeah.
But so that's what I'm saying. So maybe also figuring out that I have the capability of doing this on my own also, right? And I
right.
start building up those skills to do it.
What would be some practices to help do that?
I think practices, there would be so many of them, but I still feel things like, I think journaling is something which I always recommend, and I know it does not land well with everybody there. But also when I say journaling, it does not really mean that you have to, like I said, sit down with a paper and pen and write down.
Yeah.
Journaling could also be like sometimes just sending a voice note to myself, talking
Right.
about it there, like what's happening at my end. Then I think, again, like we talk about meditation and grounding, very scientific words. And I know these are all very socially approved ways of coping
Yeah.
with stuff and looking after myself. But I also look at it just stuff which I just enjoy doing. In terms of like, I always feel that there are these 3 layers, right? So if I can take care of these 3 layers in some way or the other in my day, like my relationship to my body,
Yeah.
my relationship to others, and my relationship to myself. So in case these 3 layers are somewhere, I'm not saying they'll not be in perfect sync every time,
Right.
but somewhere or the other, if I can take care of these 3 things,
Right.
I'm good.
Yeah. Yeah.
That
That I
is-
think that again just like comes in back and ties to the self-awareness thing we spoke about.
Yeah.
And
Yeah.
yeah. I think that's just such an important part of the training even for like kids. Which
Yes.
I feel generally like our education system has been like completely not looking at it.
Yeah.
At least
Yeah.
like my experience of schooling and all, like it's never come up to the surface.
Yeah.
That's
And
true.
I also look back and see like, at the same time, like if I look back, I really don't remember which year a certain war was fought, right?
Yeah.
Or who invented something, like what year was something invented there.
Yeah.
But in case, I mean, I'm just looking back, but in case somebody had been there to really let me know, what do I do with when I'm feeling angry? Like, what am I supposed to do?
Yeah.
What about the jealousy which I'm experiencing?
Right.
Those things were never spoken about.
Yeah.
Never. And that's what happens. It's not the feelings, like what you were also mentioning earlier, like why are we so scared of this, entering this area, right?
Right.
It's not the feelings that we are scared of. It's sometimes that because my experience with feelings has been, I've experienced those feelings in aloneness maybe.
Yeah.
That's what is the scary part.
Right.
So basically, out here, a lot of times when a lot of us have these questions like, should I be sharing this with my kid? Should I not be sharing this with my kid? What will happen? Am I sort of laying the ground for my kid to be really anxious if I share this there?
That's
it's not
interesting.
again that content there. It's just the fact that if I just don't fill in those blanks, they'll be filled up by something which may not be true
Yeah.
there.
Yeah.
So it's not the feelings at all.
So
it's
it's
just
not
aloneness.
the problem is not the nature of the emotion in itself or the feeling, but more of like how we associate with those and the memories of those things.
Absolutely. And therapy in a way is actually going back to those memories
Yeah.
and now giving it a different...
Developing a new connection with those.
New connection.
things.
That's actually what therapy is.
Right.
I go back and now I'm able to give a different ending to it.
Yeah. Given that you also work with like kids and like you do workshops and stuff, what's your reading on how's the landscape is there a landscape shift, and like how is it shifting?
So see, yes, absolutely. I remember when I just initially started my journey there.
Yeah, I'm just gonna put in one more question. Or is this just like some of this stuff can also be like gimmicky, like some places could bring it in a gimmicky way, so I'd also like you to sort of throw light on how much there's like deep intent to actually address these things and how much of it is just like surface level stuff.
So see, I remember when I initially started Siddharth, it was literally what I normally do is I've always had this passion of sort of developing emotional skills from a very young age.
Yeah.
Because it's something like normally this thing comes to light when maybe I'm a teenager or I need to sort of be good at my presentation skills and my confidence, and that's the time when we start thinking about all these things there, right? So I was very passionate about starting slightly as young as the age of 3.
Oh wow.
And I remember earlier on when we used to do that, a lot of parents would come and say like, oh, so my child will be able to speak really good English after this, right? Or my child will be really, really good at like very confident in interactions. So that was the basic aim and outcome. Like that's from the parents' perspective.
Right.
So it was a big task, and I would literally come back and pull my hair or almost after every interaction there. So this is what it started with.
Right.
And even now I feel there's been a lot of change on that front. Yes, a lot of parents are intentionally, really with a very good intention, like I really want my child to start understanding what is happening at their end.
Right.
But again, we have to also understand, and I think a lot of research also supports that with kids, it's not just that changes have to happen at the kids' end.
Right.
It's very important for an adult caregiver to be present to reinforce those things.
Right.
It's not like a one-sided. So adults have to be involved in this process. It's not like I'm sending my kid away to learn something and then this kid will turn into something perfect.
Yeah.
There. I am supposed to also put in the hard work there.
Yeah.
So I think wherever it's only like one-sided kind of a thing, it might not work for a very long time. So the adult and the parent has to be involved in the process there.
Yeah.
And that's where I think a lot of hesitation and resistance also comes.
Yeah.
A lot of hesitation and resistance comes in there. And I think it's also, and I also feel a lot of educational institutions have maybe started figuring that part out of the importance of educating our kids about this.
Yeah.
But at the same time, we also look at it. I don't know if you remember, there used to be this moral science period kind of a thing.
Man.
Yeah. So it's still sometimes associated like that. It's like that good behavior and bad behavior and this and that.
Yeah.
So it's not that's not what our emotional skills are about.
I know what crap was that.
Yeah.
Damn.
And I was just looking at it like, say, for example, we can't be isolating our emotional skills to just one period of say 30 minutes or 40 minutes.
Yeah.
In schools or anywhere, or even for that matter, a workshop.
Yeah.
Right? Yeah. It's something which has to be inculcated throughout the day.
Right.
So like, for example, if there's mathematics, a very difficult subject, and the child is feeling really anxious about not being able to solve.
Yeah.
That's where your emotional intelligence skills come in.
What
for
do
the
you think?
facilitator and the student.
Like, do you have any comments on how is the evolving landscape of technology sort of meeting well-being and therapy and like emotional intelligence? Are you aware of like what's going on in that landscape?
Yeah. So no, I just know that in the sense I was always I always feel I'm really technologically challenged. And so I think I experienced a lot of resistance to having my Zoom sessions during the pandemic, and I'm quite proud of myself. I did pretty well.
Okay.
I mean, I got used to it in the sense like
Yeah.
there. So in terms of I think well-being and emotional intelligence, I think there's so many apps which have come out.
Yeah.
There's so much of stuff.
Right.
Actually, so much of stuff that it becomes difficult
Right.
to figure out.
Yeah.
Like, what do I use and what
Yeah, that's
is there?
constantly my problem. Like
Yeah,
too much choice. Like
Too much choice.
I'm paralyzed.
Yeah, too much choice there. But I still I know, because somewhere in terms of emotional intelligence, there's this emotional intelligence center in Yale, which
Okay.
has come up with this lovely app of how I feel.
Okay.
I think, and
Okay.
that's a beautiful app
Okay.
for
I'm
checking
gonna
in
check
with
it out.
feelings. Absolutely a wonderful app for checking in there.
Okay.
And
It's called How I Feel.
How I Feel, I think
Okay.
it's called.
We'll
that.
also give like a link in the.
Yeah.
yeah.
So
Okay.
that's like a wonderful app there to actually be in touch. Like we talk about, like just checking in with yourself during your day. Like, how am I there? How am I feeling? And I think that they have this wonderful thing which we call a mood meter.
Okay.
Which involves colors, and to figure out that, say, in which color am I in right now there, and then to see if this situation demands me to shift to a different color. Like, will I benefit? For example, say if I am going in for a debate, right? I don't want to be really all just calm when I'm going in for a debate.
I
I want to be
red.
little.
I want fierce.
Yes, I want to be like charged up a little bit there.
I want to scare the other people.
So depending on the situation,
Yeah.
where would I like to be
Yeah.
there? So it gives us a very that's something which we've also been doing out here.
Okay.
With a lot of students there.
Yeah.
We've been trying to at least get them in touch with that.
Yeah.
Like, at least start checking in with yourself.
Yeah.
And,
I think in the context of what we were just talking, I'd just like to acknowledge and like give a shout out to Plaksha, because like they're doing a pretty good job at this right from the beginning.
Yes, absolutely. And I remember that we were there right before even the students came in.
Yeah.
So that was something which says a lot
for sure.
there. Yeah.
How did you discover your interest? And so, like, let's go a little into your story and on your journey. What are the challenges and difficult moments you came across?
I think I think it all again goes back to my childhood there, in the sense that I was labeled by my parent as being an abnormal kid. And there was this uncle of mine who sort of explained to me, saying abnormal means above normal. And so there was this uncle of mine who normally used to have a lot of conversations with me while growing up. Like, we had a lot of conversations, and I think he was the only one who actually asked me, like, how am I feeling in a certain way, especially during the teenage years.
Yeah.
There. And I think that got me really, really curious about figuring out what is happening at my end.
Yeah.
There. And I think I was quite sure there was no like really a dilemma of what do I want to study when I go forward there. I was quite sure that I wanted to study psychology, not knowing what I'm going to do with it after that. I had no idea that. I had no idea. So I think that is what really prompted.
Right. And once you sort of started on that journey, what challenges?
I think again after my masters, I really did not know what field do I want to go into, what do I want to do with my psychology degree kind of a thing there. And so I also did my MBA in HR, and I was in the corporate also there, but then got quite sick of it and just left it, kind of a thing, and went back to psychology, did my doctorate. But at the same time, and that was the same time when I found, like, I started doing stuff, like I found P.A.U.S.E. Like, I literally created, I wanted something where I could start sharing these skills with starting very early, not just when I'm like a teenager or a young adult kind of a thing there. And that's how it started there. And I think my own kids, I think, played a lot of big role in it, because I wanted to sort of, I wrote a few books on emotions and feelings, and that's where it came from. Because I could not find anything at that time in the Indian market to sort of
Right.
talk about feelings
Yeah.
there.
Yeah.
So that's
So,
where I started.
so you've
with
written
that.
these 2 series of children's books.
Yeah.
What have you learned about yourself from working with kids?
I think I also discovered I had a lot of patience when I worked with kids, which I didn't think I had earlier.
Yeah. Yeah.
And also I think in terms of, I think working with kids is one of the most amazing things,
Yeah.
because we actually feel as if we are teaching them so much,
Yeah.
but they come up with the most simple,
Yeah.
not thought of stuff which makes things so much easy. Like, why didn't I think of this before?
Yeah. It's like creative immersion. Yeah.
So it's actually one, and I think it's some the days when one is feeling really down and you want to boost up your self-esteem, nothing better than working with kids.
Yeah, I guess.
Absolutely nothing
Yeah.
better than that.
Yeah. I had this idea at some point, like I'd like in my life to have like a window where I can go like hang with kids whenever I want, but also like not work with them like full time, because I know that needs an insane amount of patience. I at this point I just don't think I have that. Yeah. What do you feel is like the most rewarding about your work? What gets you satisfaction from doing what you do now?
I think knowing that maybe during our interactions there is something which might click with during our conversations in therapy, or that's the therapy part there, and also the fact that and which might just click and make the other person look at things from a different perspective.
Yeah.
I think that part, that is the part which gets me going always.
How does that make you feel when somebody finds like a moment which has like a release in them?
Oh, I feel so two things. I would, like, if I have to talk in colors, I would actually be in the green, like really grateful about that also, and also at the fact like slightly proud also.
Yeah.
So both colors there.
Nice.
And really proud for the fact that it did, and also for the person, because I also feel that I think when I'm working on myself, it requires so much of courage.
Yeah.
Absolutely so much of courage there.
Yeah.
And just the fact, I also feel that when people enter the room for therapy, it's like something really to be proud of.
Right. Already they put in like incredible amount of courage to just show up.
Totally.
Awesome.
Absolutely there.
Yeah.
So that's
You have a coffee tattoo on your wrist.
Yeah,
What does that represent?
Oh, that doesn't mean, there's not much deep meaning into it, but it's just that I absolutely love coffee. And so that's why I just have a coffee tattoo.
That's cool.
It was just that basically my daughter was getting a tattoo done, so I thought, why not, I'll also get one done.
Okay. What does a day in the life look like?
So I'm right now I'm working here 3 days a week, and then I have P.A.U.S.E also going on there.
Right.
So out here, I think it's a day normally begins. My day begins with me spending some time with myself, exercising.
Okay.
Not just sitting there. And it's I think during my running, I like to run a little bit there.
Nice. I like to run too.
Yeah, and that's my time. That's actually my time there.
Okay.
And though I would as a therapist, I know I'm expected to be writing and journaling, which I confess that I don't do every time.
Yeah.
In the morning, but I do try and do it off and on.
Okay.
So it's my time and space, and I love when I'm writing. Then I write.
Okay.
Like, I love doing that,
Okay.
and that's what keeps me going there. And of course, my cup of coffee.
Uh-huh.
So one in the morning and one in the evening, maybe. And that's something where I don't want to be. It's like it's a time which I really enjoy.
Yeah.
And
it's also like your pause time.
Yes, that's like my pause time there. I would literally like to pause there.
Right.
And I think I do try and take that word pause and bring it into my life as much as possible.
Yeah.
There.
Yeah.
So it's literally like find those pockets of time when we can pause.
Right.
So that we can function
Yeah.
later. And there.
Yeah.
So So that's how my day begins, and my day also sometimes when I come back from work, and I know again I not a very politically correct answer, but I do watch. I love watching shows on Netflix.
Love the politically incorrect stuff.
So I do, and I normally when I do have sessions and people are talking about shows, and I'm so curious to know. So which show are you watching there?
Yeah, I'll tell you later about some of the fun shows that
Please.
I've had the chance to watch.
Do that.
Awesome. Yeah. Would you have any advice for young people?
Okay, always like not an advice thing, but I remember even when I took a session with our students when they were entering Plaksha there, and I remember I was told like, would you like to tell them some things there? So we literally went into stuff which I actually shared stuff with them which said that, okay, 10 things which show that you are an adult now. Apart from the age, that you are 18 plus, just does not mean that you are an adult.
Okay.
So we spoke about a lot of those things, and I think and at that time also I think the emphasis was more on the fact that start making friends with your emotions and feelings. Because the more we get into a better relationship with our emotions and feelings, it's easier.
Yeah.
Like it's literally like the more I resist, that feeling persists. So it's literally like I'm at this point of time, I'm pushing them away. I'm keeping them at a distance. I don't want to acknowledge them.
Right.
Thinking that if I do, then it's going to become really bad.
Yeah.
But it's just the opposite.
Right.
It's actually the opposite.
So this
there.
friendship basically means developing like a healthy connection.
Healthy connection, understand them better, know that feeling and emotion better. Why is it there?
Because sometimes like that in itself is a challenging process to like to attribute things or to just see things for what they are. You know. Yeah. And
so I think and again I bring that word pause.
Yeah.
It actually comes back.
Yeah.
P.A.U.S.E.
Yeah.
So for any emotion, so either we will bottle up those emotions or we'll continue to brood and think a lot about them, right?
Yeah.
Those are the two ways all of us do that. And in some situations it's required to do it, right? But if that becomes like every time I'm either bottling it up or just brooding over it, it becomes really difficult then.
Right.
Then I'm literally creating conditions for
things to go south, obviously.
Absolutely.
For sure.
Absolutely.
For sure.
So I think my one thing would be, please start making friends with your feelings and emotions.
Yeah, that starts from recognizing them in the first place.
Yeah.
I think that's already like a big step towards. Yeah.
And also when we talk about recognition, you really don't sometimes have to have an exact word for it.
Yeah.
It could also be like, I'm just feeling really uncomfortable here. Like there is something which is not feeling right there.
Right.
And then sitting with that for some time, trying to figure it out. I'm not saying every time the situation will be that where you can devote time to do that.
Yeah.
But come back to it then.
Yeah. Awesome. I think it has been a fantastic conversation. We'll bring it to a close soon. But before we do, I have a few fun questions for you.
Okay, cool.
Can you tell the audience a therapeutic joke?
Oh my God.
I've been asking this like every time like I ask someone, can you tell the audience a biological joke?
I really can't think of one, Siddharth.
Yeah, that's okay. I just like the idea of putting you in a spot.
You have.
Forgive me. What do you feel is the purpose of your life?
I feel the purpose of my life is actually to sort of when I talk about make friends with emotions and feelings, I always feel just making friends with what is happening with me right now. That's the purpose of every moment. Yes.
So it's like a very Buddha like.
I might be biased also again towards that because I love reading about Buddhism also. Right. But at the same time, I think my purpose of my life is actually, and so many times that does not happen.
Yeah.
A lot of times it does not happen.
Yeah.
But just that awareness that whatever may be happening, let me first accept that
Yeah.
this is happening to me.
Yeah. I
It's
think
not
that kind of
something.
runs parallel to the idea of equanimity in Buddhism.
Yeah.
Yeah.
So that's something, if basically if you ask me, but otherwise I think I've also feel that it's like literally in very basic simple terms, it's like a basic rule, like putting a smile on myself and also seeing that it does not, like I can take care of myself, but in that process I don't have to hurt others. And it's possible.
Yeah. I have one last question for you, and this is also a fun one. I'm sure you'll have an answer for it. What does a therapist rant about with another therapist?
It's literally like okay, like this will be like an inside joke there. So literally with another therapist it was like, so like how messed up was that client of yours?
This was an amazing conversation. I learned so much.
I enjoyed myself too.
Yeah.
And I'm so glad I was not looking at the TV.
Yeah. Thank you for being here. It was an honor.
Thank you so much. Thank you so much. I really enjoyed this conversation there.
Thank you.
Absolutely.